what further research is being done on IL-2 as a diagnostic biomarker?
Okay, IL-2, it's the formal name is interleukin 2. This is a cytokine, which is a small molecule that is a signaler or communication device that white blood cells use with each other to alert other white blood cells. Hey, come here, there's inflammation going on, there's a problem. It turns out that IL-2 is one of the big players in celiac disease. People with celiac disease who, when they eat gluten, get really sick, they typically have a big spike in blood IL-2 that's measurable. And so it's become useful as a potential diagnostic to figure out if someone has celiac disease. Now, we've got good blood tests for celiac disease. They're not perfect, but they're good. But that's only in people who are eating gluten. What about someone who's been gluten-free for years, but they don't know if they have celiac disease for sure? That's really hard. And some of them are unwilling or unable to start eating gluten again. So there is a group out of Australia that is developing an assay, a test that basically takes that person's blood, puts it in a tube, incubates it with gluten, and sees what happens to IL-2. So it's an in vitro gluten challenge. You don't have to give the person gluten, you give their blood gluten in a test tube. These results were presented at a national meeting last spring, not yet published in full peer review. So still, exciting, but all the data isn't yet out there. But it's potentially a very promising advance if it turns out to be true.